We are so delighted to welcome Ms. Fumie Sakamoto. Thank you so much for coming today.
Thank you for inviting me.
Um, we would like to hear your insights and your interest of research. Could you give us any message to future nurses and nursing students who will
Uh,
become future leaders? Thank you.
Before I introduce myself, I'd like to thank Ms. Teramoto and Professor Tishima for inviting me to speak today for this wonderful project. It's a great honor and pleasure to be able to share my experience and thoughts with all of you who are watching this recording. Um, my name is Fumie Sakamoto, and I was born in Japan and grew up in many places in both Japan and America. In 1991, I graduated from St. Luke's International University with a bachelor's degree in nursing and then finished a master's program at Columbia Mailman School of Public Health in 1997 with an MPH degree. I also have maintained my CIC certification by the Certification Board of Infection Control and Epidemiology since 2003. For the past 20 years, I've worked as an infection preventionist at St. Luke's International Hospital, which is a 520 bed acute care hospital located in Tokyo, Japan. My job here is to do healthcare associated infection risk assessment. I collect information about effective measures to reduce the risk of infection and implement these measures with my colleagues. I work with a lot of frontline workers as well, and through them and with them, I try to improve patient outcomes. So, since infection prevention is the area of my specialty, my work and my everyday life for the past year has very much centered around COVID 19. And today I would like to share with you what I have experienced over the last year, as well as some thoughts about the current challenges and hopes for the future. I believe it was December 26, 2019, when I first read a news article about an outbreak of mysterious pneumonia taking place in Wuhan, China. And at that time, there are flights packed with tourists coming in from Wuhan to Tokyo almost every day. And there were many tourist attractions nearby, such as the fish market, Kabuki Theater, and Ginza Shopping District. So it seemed quite possible that in the not too distant future, a tourist with fever and respiratory symptoms would show up at our reception desk. And so, as soon as the New Year vacations were over, we started preparing for such an occasion. This was, of course, not the first time we had to deal with an emerging infection. There was SARS in 2003, novel flu AH1N1 in 2009, and MERS in 2012. And in addition to that, every year up until 2019, we had conducted pandemic flu preparedness drill with our local health department. So at the beginning of the COVID-19 pandemic, we'd been a little bit prepared. We were okay as long as there wasn't a line of patients forming at our doorstep, just like the scenario we had used for the annual drill. And in fact, in the first 2 months of the pandemic, in January and February, we only had a few confirmed cases, and all of them were travelers from a foreign country. Um, our first COVID patient was a tourist from China. He was admitted on January 22nd, and 2 days later, another tourist was admitted. And that was all for January. It was no big deal. Then in February, we had another two patients who were passengers on a cruise ship, which was docked at Yokohama port. And until February, wasn't our problem. It was something that was happening abroad, and we were just helping the tourists get better so that they could safely go home. But in March, uh, we had a surge of confirmed cases. Most of them were residents of Japan. They were older and much sicker. And now COVID 19 was clearly our business. At our hospital, we soon had to dedicate one of our ICUs in a ward to take in COVID 19 patients. Um, then came this nationwide shortage of PPE. Surgical and N95 masks were running out. We needed to restrict their use and started reprocessing N95s. And at the beginning of the pandemic, we knew very little about the disease. So there was much fear and uncertainty about the risk of infection among our frontline staff, especially among nurses and residents who were always closest to the patients. And as it became clear that COVID 19 could be transmitted from pre symptomatic patients, the staff also began to worry not just about getting infected themselves, but also unknowingly infecting others, including their family and friends. And as an infection preventionist, I didn't want them to feel that they were at risk of infection while at work. I didn't want to rely on their devotion or enthusiasm and treat them as heroes who were risking their lives. And I wanted to support them by providing up to date and scientifically sound information about the disease and the ways to prevent it so that they would be able to perform their duty calmly and safely as professionals. These thoughts were shared among all the departments at this hospital, including employee health, facility management, general affairs, purchasing, and administration. We held regular training sessions to update our staff's knowledge and skills, provide weekly update on the situation of COVID-19, opened a mental support desk. We tried to stabilize the supply chain for PPE. We sometimes offered them snacks and prepared accommodations for those who were concerned about the risk of household transmission. And after the first wave subsided in April, we experienced the second wave in the summer and the third wave in the winter, which was the biggest by far. And to date, more than 1,400 patients, including 465 confirmed cases, have been admitted to our hospital. And unfortunately, 12, 12 of them have died. In the meantime, the nurses have continued to do what they had to do, and they've stayed so calm that it was as if caring for COVID 19 patients had always been a normal part of their duty, although we wish it had been otherwise. Recently, an ICU nurse came up to me and said that she no longer felt fear when caring for COVID patients because she now knew about the characteristics of the virus and how to prevent infection. And I was really thankful for her for keeping up her knowledge and skills and staying safe for almost a whole year. And I was impressed when she said it was knowledge that helped her stay calm. Some people say knowledge isn't enough to eradicate fear of infection, nor does it wipe away the loneliness that young healthcare workers like her are feeling right now because they're not allowed to gather with their peers and have fun as they used to. And I agree. But I also think that to alleviate fear and to control this pandemic in order to get out of it and to get out of it fast, knowledge is indispensable. It is what protects us and guides us on the way out. In this unprecedented disaster, there are two things that are trying to control our lives. One is, of course, SARS-CoV-2, the virus that causes COVID-19. And the other is misinformation. In this pandemic, social media have been so helpful in the rapid dissemination of scientific information. But at the same time, unreliable or false information has been spread just as quickly. And it's been so difficult for non specialists to distinguish between the two. We tend to see and interpret things as they meet our ideas. When we have fears and worries, we may unconsciously choose and believe information that indicates that our fears and worries are in fact true. We also tend to reject information that tells us our fears and worries are unnecessary and meaningless. Last week, I received my first dose of COVID vaccine. And I was receiving the shot. I was thinking about March of last year when we were in the middle of the first wave. Who would have thought that a vaccine with 95% efficacy would be ready in just a year? This vaccine could be our ticket to our survival and return to normal life. But for it to be so, we need to raise the vaccination rate high enough to gain herd immunity. And to do that, dissemination of science backed information about its efficacy, effectiveness, and safety is vital. And people need information to decide whether or not to receive the shot, and that information needs to be based on facts and not on feeling or hearsay. Every healthcare provider, including myself and you who are watching this video, has a role we could play to support people make their own decisions about vaccine and other infection prevention measures by communicating facts in a way that's easy to understand. Uh, we need to be careful not to look for stories that strengthen our fear or anger that we are already feeling, but be a person of calm, reason, and humor. Staying that way helps not just your patients, but also yourself and your family. Have confidence in whatever decisions they and you will make. Well, what a year it has been. It's not over yet, and will probably take another year or two until it's over. And there's another bad news. Um, there will be another pandemic in the future, and that's for sure. But there's also good news, a very good news. This knowledge and experience and skills we have gained through these difficult times will make it easier for us to overcome the difficulties we will face in the future, and that's for sure too. Please stay safe, get vaccinated if you can, and thank you very much for watching.